Now, bacterial meningitis, this is a topic which is more important for you per se. So it's a clinical diagnosis mostly, and the fluid will contain a lot of inflammatory cells, predominantly being neutrophils. Cloudy turbid CSF is there with a raised protein level and a reduced glucose level. Now, this is a picture which is showing these numerous neutrophils in the CSF sample of a 23-year-old woman who has bacterial meningitis. And there are, this is not exactly showing very clearly, but there could be these diplococci which are there, gram-negative ones inside the neutrophils, which is characteristic of Neisseria. So this is one picture that is from the book, that is gram-stained smears of the CSF. The first picture is showing us Neisseria meningitidis, which is within the neutrophils. You have these gram-negative diplococci. And then you have Streptococcus pneumonia, which are gram-positive diplococci that are found outside the neutrophils. And in the end, you have Haemophilus influenza, which will show you these gram-negative cocci. Now coming to tubercular meningitis, it is clear or slightly cloudy appearance with raised protein levels, reduced glucose levels, and a cell count which is usually a mixed pleocytosis, mainly lymphocytes. And coming to this, you will find these basically lymphocytes which are there, and it could be a mixed cell reaction as well in the CSF. Viral meningitis, a clear CSF, protein level usually is not exactly raised, or it will be raised at the end of the normal. And glucose level is usually within normal limits. Predominance of polymorphs can occur in the first 6 hours. IHC is helpful in differentiation from lymphoma in certain atypical appearing cells. So these are the reactive lymphocytes in viral meningitis that you find. So reactive cells would have a bluer cytoplasm, and there'll be the edges can be a bit tailed out. Fungal meningitis, Cryptococcus neoformans, is a common infection in immunocompromised patients. India ink stain is used basically for it, and again you'll see lymphocytosis, and you'll find the organism on the India ink stain. So this is how it appears. HIV meningitis, there will be a wide variety of CSF abnormalities which can be seen, like lymphocytic pleocytosis, elevated IgG index, oligoclonal bands, and these are the things that you'll find in HIV. Now, chemical examination of CSF, which is basically like protein detection, is there. The normal level is 15 to 45. It's like high in sensitivity, but it's not a very specific test that you can get done. It's measured by these two methods. Turbidimetric method is used very often. Now, this can be increased in meningitis, spinal cord tumors, multiple sclerosis, or GB syndrome. Remember that albumin is never synthesized in the blood, whereas, this is the CSF, not blood. Albumin is not synthesized within the CSF, whereas IgG, immunoglobulins, will be synthesized. Now, glucose, normal is 45 to 80 mg per deciliter in CSF. It's measured by glucose oxidase method. It can be decreased whenever there is acute bacterial meningitis or tubercular meningitis or fungal meningitis or hypoglycemia. Now, what is important is you have to take the blood glucose sample 1 hour before taking CSF sample so that you can correlate that whatever is the blood glucose level, 2/3 of that or 60% should be in the CSF. And CSF glucose is normal in viral meningitis. This is very important. Now, microbiological examination could include direct wet mount, which could show a suspected cryptococcus, amoeba, or candida. Gram smear will get done if the sample is turbid and there are increased neutrophils. So you will find gram-negative organisms within the neutrophils in meningococci, gram-positive diplococci with unstained capsule, that's in pneumococci, and gram-negative, again, organisms you find in H. influenza, and gram-negative rods are seen in E. coli. Now, age groups, this is important. 0 to 6 months, usually group B, streptococcus, is what is causing the meningitis, bacterial meningitis. 6 months to 6 years, it's mostly streptococcus pneumonia. 6 years to 60 years, especially in teenagers and adolescents, we have Neisseria meningitidis. More than 60 years, there's streptococcus pneumonia again, which is the most common organism. These are only the most common organisms. Now, Zeal-Nielsen stain will be something we'll get done if tuberculosis is suspected. Then you have latex agglutination, which will detect a bacterial and cryptococcal antigens. For example, in Neisseria, we can detect groups A, B, C, Y, and W135. In H. influenza, capsular type B is detected. Serological testing for syphilis can be done. So this is a combination of the FTA-ABS test, which is your fluorescent treponemal antibody with absorption test in the serum. along with reactive VDRL test in CSF is a confirmation for syphilis. And we get PCR for tuberculosis, and CSF culture is actually the gold standard for bacterial meningitis, for which we use tube 2. We can use these culture media like chocolate agar, blood agar, McConkey's agar. For fungal, we have Saborod's agar. Special investigations are there, like CSF electrophoresis is done. If oligoclonal bands are detected in the gamma region, then multiple sclerosis is most often the diagnosis. And if suppose a patient is having rhinorrhea, there's some sort of a transparent fluid which is leaking and you want to confirm whether it's a CSF or not, there's the transferrin band or the tau protein which will basically come positive. That is not found in any other clear fluid. So that's how you know it's a CSF.